Quan, you looked at my blood work, right? Giving me everything I need. From what you've seen in my blood work, do I look like, or my blood work look like I'm blasting Tren, Deca, 2,000 milligrams of test a week?
Hey guys, it's your Gentle Giant here. I'm here with MJ, Myron Jackson here. So we met at, where did we meet at?
The Arnold.
Yeah. So we met at the Arnold, had a great conversation. Well, first, his wife knew who I was already, and then we got to talking about what I do for athletes, what I do for bodybuilders, what I do just for everyone, both male and female, regarding hormones and being optimal. So when we was talking, he's never really had a full blood work panel to check everything, because as you get older, we're not able to function like we used to, right? We don't recover like we used to. I don't care who you are. Superman at some point does lose his power. But you know, what my job is to do is make sure that you continue to be Superman as you get older, right?
Yeah,
so as you get older, things start to decrease, whether it's your growth hormone, your testosterone, you know, all those things. So I go in-depth blood work so we can make sure he's optimal with everything he's doing, because as you know, he's a tremendous business owner. He has a wife, he has a family. So he wants to be 100 all the time because there's so many things to balance. Well, that starts with your blood work to make sure you're able to do all those things.
Absolutely.
So tell me some things that you've noticed that you, okay, let me get some blood work and see.
Definitely my recovery. My recovery hasn't been what it used to be. You know, I used to, leg day. I'll be leg day on Sunday. I'm ready to go Tuesday. It's taking me a little bit longer now. It's like almost the whole week. So that was problematic, obviously. And my sleep has been, I get up early, but in the past I've been able to maintain a good level of sleep, but it's been pretty sporadic as of lately, you know what I'm saying? Mm-hmm. And that's concerning as well. And my strength has been kind of up and down over the last couple of years. You know, I have my good training days and I have my bad training days, but it has been very inconsistent, and that is that's a problem for me. Mm-hmm. You know what I'm saying? So those are the three major factors that really made me say, okay, I need to take a peek underneath the hood and see where my blood work is at, and see where my hormone levels are. So that's what brought me to you.
Yep. And a lot of people walk around knowing these things, but don't really know what they can do. But guys, blood work is the easiest way to map out everything that's going on with your body. It's one time. Invest in your health. Blood work does not lie. I don't care who you think you are, what you think you're doing. I'm like, okay, I hear you. Wait till I see the blood work and we'll really see if you're telling the truth.
Yeah.
So we got his blood work in, and we're just gonna go over that. So you guys know he has great genetics. Let's start there. But at the end of the day, you know, it's about the effort you put in with your workouts and your nutrition. I don't care if you enhanced or not.
Yeah.
You have to put in the work. So I just want to make sure that's clear to all y'all people that accuse me for even being on that. Yes, I'm on testosterone, but I guarantee half of y'all can't even hang with me in the gym. So we're going to go over here and talk about, we do kidney function. Mm-hmm. So your kidney function looks great. What we check is called your GFR, your filtration rate, to make sure that's good. We also check potassium, sodium, to make sure those are good, and make sure there's no signs of dehydration.
Yeah.
We check the bilirubin and globulin. That has to do with the gallbladder. So any of those that are elevated could be gallstones or some inflammation in the gallstones, and those are normal. So what we have here is elevated ASTs and ALTs. That is a part of your liver function. Mm-hmm. So with that being slightly elevated, I do recommend a normal supplement called milk thistle or TUDCA or NAC. Those are all bringing that number down. And even if you wanted to go further into things like glutathione, it's a great twice a week injection that helps to flush out the liver. Mm. And also here, vitamin B12, an optimal level is 1200 or higher. We're at a 456 here, so definitely could utilize some vitamin B here. And everyone is different as far as if they're able to consume the capsules. If not, then we'll do the injectable version of that, which is normally 5,000 micrograms is the sweet spot for that twice a week. So vitamin D, a lot of people are lacking vitamin D. So vitamin D is great for your immune function and also for joints. Being that he's having joint issues, even women, you want to make sure that you're optimal in vitamin D.
Yeah.
And optimal level is 80 to 100. He is at a 14.
Oh man, come on,
no sun. He been hibernating.
It's been the winter.
Exactly.
That's that light caramel he claimed he is.
Uh-huh.
You try to stay out the sun.
Yeah. Hey, you gotta get some sun to get my complexion out.
Yes, sir.
But so with that, typically I will suggest a vitamin D3 with K2. A lot of people take vitamin D3, but they're not taking the potassium that makes it more soluble and bioavailable for your body to use. And also you need to take it with fat as well.
Wow. Gotcha.
And then we check the full thyroid function. A lot of doctors do not do it correctly. They just do a TSH, and if that's low, they think somebody has hypothyroidism. But it takes more of that to actually diagnose it. You're going to be looking at things like your thyroid antibodies, your free T4, free T3, reverse T3 as well. And so from looking at his blood work, he does not have thyroid disease. His T3 is also optimal as well, which signifies his metabolic rate and energy levels should be up to par. And for guys, one of the most important things you want to check is the PSA. So if it's elevated, it could mean that they have benign hypertrophic. That means that they have a enlarged prostate, or they could have prostate cancer. So if that number is really, really high, you want to make sure that you get an ultrasound or CT scan just to rule that out before starting therapy. And if so, they have a doctor, you want to collaborate with the urologist to be on the same page, because a lot of people with a high PSA also have low testosterone. And in his case, testosterone level is about 850. I know y'all shocked because of the way he looked. But what I'm looking at, a lot of people have the misconception, they're always looking at a number. They'll ask me, what number should I be at? Right. It's not the number I'm looking at. It's like, okay, when you come back to see me once we begin therapy, were those symptoms that you discussed, were they fixed?
Right.
Okay, a guy can be at 2,000,
right,
but if his liver enzymes are good, his prolactin levels are good, he doesn't have high red blood cell counts, that's what I'm looking at. And just making sure they don't have a prostate cancer. But if someone feels great at 2,000, then that's where they're gonna be at. So I'm not looking for a number. It's about symptom improvement. And that's why every program is different for each person, because someone might be feeling great at a 1,200, whereas another person might be feeling great at 2,000. Everyone is different. And that's how I learn your body and how it responds to the therapy. And then we checked the estrogen. Estrogen level was a little elevated. So of course, when we start testosterone therapy, you want to make sure that we're going to be doing an estrogen blocker like Novadex or anastrozole, because when you give yourself an external source of testosterone, you are going to inadvertently convert to estrogen. I see a lot of people taking testosterone and not doing estrogen blocker. Yeah. And they come to find out that, well, I'm on testosterone, why don't I feel like I'm on it? Estrogen high as hell. You put the tourniquet on them and it disappears. Right. That shows me that they are retaining water right. and fluid because of the high estrogen. Right. So many people do it wrong. You have doctors out here giving people shots once a month. What the hell is that gonna do?
I've been noticing I've been a little bit, sensitive.
Been teary-eyed?
Yeah, man.
So
I be watching these little movies.
Do I need to phone your wife?
Yeah, man. She got me watching these girly movies all the time, and I was like, man, I had a teardrop. I was like, what's going on? Let me get my testosterone check, my estrogen check.
Exactly. But people don't realize that it's, guys need estrogen just like women need it, and vice versa.
That perfect balance.
Women need testosterone just like guys need it, but the quantity is very different.
Right.
Okay. And so we make these recommendations for liver improvement, estrogen blocker, of course, and we are going to start testosterone. B12, vitamin D is a part of the program as well, and also the fatty meal. And I always tell people, even if you were to be on a supplement, like let's say a peptide for your thyroid or for your prostate, all of these are bioregulators which just makes your body to produce more so that it can function well. So you don't have to have a thyroid disease. We're just trying to make it more optimal. Okay. Cholesterol was great. I don't have to say nothing about that. And so guys, this is generally what it looks like when you're going over blood work with a patient. Right. And if there's other things that I need to test, like homocysteine and other things, if somebody has inflammatory diseases or stuff like that, or they're having issues with their bowels, we also check things like their blood type, because some people may need to eat their blood type in order to reduce inflammation. So everyone is different when it comes to that. When they're losing weight, you can eat your blood type and that'll help people to lose weight, not have inflammation, because with that, you can have acne, You can have high stress levels. You can retain water, gain weight. All that can be because they're not eating foods that could be worth their blood type or that they have sensitivities to.
Right.
Yeah.
Okay. Gotcha.
And yeah, guys, so this is how we do it. He will get his stuff shipped to his house from the pharmacy. He'll get a unpacking so you guys will see that.
Yeah.
So we're also going to do peptides as well. So what peptides are designed to do is they perform any function, right? Yeah. So if you have inflammation, you can use what's called the recovery blend that has TB and BPC in it, which we also call the Wolverine, the GHK, and the KPV, which is great for inflammation and also is used for allergies and to fight bacterial and viral infections
Hold
as
on,
well.
what did you call it? You said Wolverine?
Wolverine.
So I'm gonna be able to recover faster?
Yeah, you remember how like if you stab Wolverine and shoot him and it just covers up? That's why it's called that.
Man, bro, don't have me out here feeling like I'm in my 30s again, bro.
Yeah. And I mean, I tell you, that is one of the best peptides you can take. Because I know for me, when I went to London and I forgot my peptides, and I worked out like I normally do, when I tell you I was so sore, man, I had to do ice bath, red light, and that's when I really knew. Because you never know how something works until you're not taking it. Like a lot of my clients who I prescribe DECA to, which you can prescribe, y'all, for joints. Before it was used by bodybuilders to gain muscle, it was FDA approved for people with joint pain and muscle wasting, like people with HIV and AIDS. So a lot of my clients say they were to stop the DECA. They're like, man, my joints is killing me. That's how they know that it really works.
Gotcha.
Yep.
Gotcha. Wow.
Yeah, so a lot of these things that people are using for, as PEDs were used for other purposes before bodybuilders got hold of it to do other things with it.
Okay, I'm gonna hold you to that.
Yeah.
Okay, because I've heard a lot about peptides before.
Yeah.
I've done a little research on it, but I haven't done an extensive amount. But I heard great things, so this is my first time trying it out. So I'm gonna be honest, I'm gonna be brutal. So next time I see you, I'm gonna let you know if it works. Because I got some inflammation going on in this body.
Oh, I know. I know. And then, we're gonna also let him go home with the exosome cream. So that's like stem cells in a bottle. I call it a bottle of crack. Y'all hear me say it all the time. Rub it on your joints, do your red light. Promise you, the increase in blood flow. Yeah. A lot of patients love it. I had a patient had a fracture in his foot. And he did the BPC and the cream every day. Probably about 2 weeks, 90% success rate. He feels so much better.
Oh yeah, I need that crack and I need that Wolverine.
Yeah,
I need both.
I call it legal crack.
Let's go.
Yep. So guys, so that's generally what we do. As you can see, I'm have a very trusting relationship with my clients. We talk about everything, whether they're bulking or cutting. Everything is a transparent relationship. I know what they're doing and why, because I keep notes so I know how their body responds to anything that they're doing. So whether you're a bodybuilder out there or a regular person that needs testosterone, this is for everyone. This is not consider testosterone something like taking vitamin D and B12. In his case, he has a 14. So what do we need to do? We need to give him an external source to raise it so he gets the benefit. Testosterone is the same way. Your body's not producing it like it used to. Therefore, we're giving it an external source so that you could feel great all the time. So think of it, that's why it's called hormone therapy. Yeah. So all the myths that you hear about, becoming angry, no, that's your excuse for already being an asshole. So if you were an asshole before, you're gonna still be one when you, or worse one when you're on testosterone. So don't blame that on nobody, that's you.
Exactly.
Yeah.
Exactly. No, I appreciate it, man, because no one has ever been this thorough with me when I went to other places. So I can appreciate it. Even learning, we've had a conversation prior to me coming about the peptides and the D12, B12, and all of these different sources. So I'm excited. I'm excited to see what I can do, and you can make me optimal, because I am getting up in age. I'll be 44 this year, and I ain't gonna hold you. It don't hit the same getting out the bed. You know what I'm saying? I gotta work a little bit harder, which I'm not afraid of. Hard work, obviously, but I want to make sure I'm optimal for where I'm at in my life.
Correct, because you got a lot going on.
I got a lot going on.
Grandkids, you got
I got kids, grandkids, a wife,
a
business to run. So I'm up early. My schedule. I'm up at 3 o'clock in the morning. So I have to perform at a high level, pretty consistently. So I'm excited.
Let's guys, and to end with that, it's just like there is nothing wrong with taking something to make you more optimal.
Right.
And the whole myth about testosterone killing folks, Y'all, my oldest patient is 92. He gets pellets. His son drives him every 4 months from Fairhope, Alabama, 5 to 6 hours away to get his pellets.
So let me ask you this. Where's my camera? This is my camera right here. So, Quan, you looked at my blood work, right? Giving me everything I need. From what you've seen in my blood work, do I look like, or my blood work look like I'm blasting Tren, Deca, 2,000 milligrams of test a week? It's pretty standard and normal, right?
Correct.
Because for some reason, obviously because of my external look, people think that I am, I'm abusing, PEDs, but I've never done that at all.
Yeah.
I've really relied on just the hard work, my nutrition, and just staying consistent and disciplined. You know what I'm saying?
Because even before you have grown your Instagram, nobody saw what you did in the back of the heavy lifting, the cardio that comes with it. Even with me, I'm like, yo, I do 40 minutes of cardio every day.
Yeah.
No one looks at that. They only see the external source. And it's always the people that you got the same amount of time in a day as me. What you doing? You over here texting on Instagram about the way I look instead of you getting your ass at the gym and doing something about it.
Right, facts.
So those people are, like they always say, if you're not doing something right, what's the saying?
100%.
Exactly. So it's, and it's just one of those things where at the end of the day, especially, our African-American counterparts, we are the laughing stock when it comes to not taking care of ourselves. We rather spend money on clothes and shoes instead of taking care of our bodies. Like, I would never understand that. But then in that same breath, hate on someone for who does take care of themselves.
It's pretty disturbing, and I'm very passionate about it because I want to see my brothers and sisters, doing well and taking care of themselves, especially the women. Because they are pretty absent when it comes to any kind of resistance training or even being present in any kind of activity. So we're going to do some work because it's a mission of mine to just bring awareness to that and making sure my brothers and sisters are headed in the right direction.
Exactly.
So I appreciate it.
Exactly.
Definitely.
One black person at a time.
Yes, sir. My guy.
Yes, sir.